Proper hand washing is imperative to patient health and is considered the most cost-effective way to reduce bacteria and disease transfer. The World Health Organization has estimated that thoroughly washing hands with soap and water could reduce diarrheal disease-associated deaths by up to 50% and reduce the risk of respiratory infections by 16%. Despite efforts to increase public awareness, hand hygiene compliance rates are difficult to influence and remain very low. Interventions have been tested in numerous settings. However, no single intervention has produced consistent and lasting improvements in hand washing rates. Adherence to hand hygiene practices among healthcare workers ranges from 30 to 60%, but rarely exceeds 50% in hospital settings where significant efforts have been made to promote hand hygiene. The two research questions that we focused on were: one, is there a statistically significant relationship between how often an individual washes his or her hands and how often he or she shows significant signs of illness? And two, is there a statistically significant relationship between the amount of triggers that prompt a person to wash his or her hands and how often he or she experiences significant signs of illness? The survey was sent to a convenient sample of 200 students that were enrolled in and attending BYU, Idaho. Research was conducted according to the responses of 150 participants of the survey. The survey was created and collected using Qualtrics and included 8 questions related to hand washing and symptoms of illness. Participants were asked to state their age, gender, how often they wash their hands, how long they wash their hands for, which activities, if any, trigger them to wash their hands, and which symptoms of illness, if any, they have experienced in the last 6 months. For the sake of the study, if the individual experienced 3 or more symptoms of illness in the last 6 months, they were considered to be experiencing significant signs of illness, while those who experienced less than 3 symptoms of illness in the last 6 months were considered to not be experiencing significant signs of illness. Of our results, we conducted 2 chi-square tests of independence, and we wanted to determine statistically significant relationships. Based on our data, the relationship between triggers and signs of illness was not significant, but the relationship between the amount of triggers that prompt a person to wash his or her hands and how often he or she experiences signs of illness was significant. In Table 1 and Table 2, you can see that the p-value was not significant in Table 1 for the relationship between how often an individual washes and how often they get sick. In Table 2, you can see that the p-value was indeed significant for the relationship between the amount of triggers that prompt a person to wash his or her hands and how often he or she experiences signs of illness. In the 2 pie charts, the first one is those who have washed their hands 3 or more times a day, and the numbers read 69.2% of individuals that experienced signs of illness in the last 6 months were those that did wash their hands, while the remaining 30.8% of individuals did not experience significant signs of illness. Although the results showed that there was no statistical significance between how often an individual washes his or her hands and how often he or she shows significant signs of illness, many other researchers have found that proper hand washing is related to reduced illness. We decided that our results may be more accurate if we would have used a larger sample size, more variables, or if we would have asked more detailed questions in our survey.